Left of the box. Broken teeth, infected gums, 46K claims filed so far with Canadian Dental Care Plan. So this was something that the NDP, propping up the Liberal government on the federal level, has helped to push through. A very milquetoast, watered down, means-tested dental care plan. So it's not universal dental care, not by far. That said, what they've already come across with just that is horrific. 9,000 oral care health providers have signed up as Ottawa to take a Simplify Insurance program. So the dentists have to actually sign up for this plan. It's not automatically put to a lot of dentists. It's not automatically put in place. It's not like a doctor's clinic, which is automatically part of OHIP or anything. So the clinics actually have to sign up for this. And right now, this is for seniors, people over a certain age can apply for this, or children under a certain age with a certain income type thing. And it doesn't give you full coverage. It gives you coverage up to a point. So however many $1,000 a year. So if you fall under that 1,000, you're fine. Or that amount, you're fine. If you need more than that, you're not fine. And already this is what's happened. Massive cavities, mouthful of broken teeth, bleeding gums, and abscesses. They're just some of the serious dental issues Dr. Melvin Lee has treated in less than 2 weeks of providing care under Canada's new public dental insurance plan. Like, I have some very basic coverage right now because I'm on ODSP. And so it covers cleanings, it covers cavities, but I'm worried because back when I had a job and some more dental coverage, I was able to get some other things done, but I need a crown on one of my teeth. If I don't get it, I risk losing it. Disability doesn't cover that. And if I lose it, I lose it. I don't get an implant. I don't get anything to help with that. And some people will say, well, this dental plan, the one that I'm pointing to on the screen right now, is going to be expanded to people with disabilities. Yeah, I'll believe it when I see it. Because like with other programs, it could only just be for people who have the disability tax benefit that would then be accepted onto this program. And less than half of the people who rely on disability across the country receive that tax benefit. I'm not one of them, so I wouldn't be able to get that plan. I've seen a lot of patients that have infections, not just dental emergencies, but borderline medical emergencies, the Ottawa dentist said. Oral health is physical health. If you have infections in your gums that can affect the heart, the brain, the blood, your nutrition in general because of what you can eat, like being able to eat is kind of important for people's survival. And it's so ridiculous that we have a system where it's like, we're going to, repair, let's just say the brakes and muffler, the front brakes and muffler on a car. But if the rear brakes go, you're on your own. Instead of just providing everything that would keep the car up and going. But nope. If your windshield falls out, we're not going to do anything about it. But your front brakes, they're covered. Your muffler, that's covered. Indicating lights out, not our problem. Like it is, they're just picking and choosing, but you need all of them in unison in order to actually provide full physical health, because then you have people that will end up straining the system more because they become medical emergencies. Whereas this is preventative. If they had just had the proper dental care ahead of time. Like a lot of people, if they just got proper cleanings and cavities filled, they wouldn't have a lot of these emergencies. They wouldn't be borderline medical emergencies for just that simple thing, cavities filled and cleanings. I haven't seen patients in this condition since I did overseas mission dentistry work in Haiti and Peru. Yeah, there's a reason why he didn't see it, because the people who need it can't afford it, and it just keeps getting worse. Lee is one of nearly 9,000 oral health care providers who have signed up so far to provide care under the Canadian Dental Care Plan, CDCP. That number has grown significantly since last month when Ottawa said 5,000 had registered. There are approximately 30,500 oral health care providers across the country that could sign up. The public plan eventually will provide dental coverage for 1 in 4 low and middle income Canadian residents who don't have private dental coverage. 1 in 4. So 3 in 4 will not get it. Good to know. Yeah, 3 in 4 people, you're out of luck. But that 1 in 4, you're good for some stuff. As of May 1st, eligible seniors 70 and older are covered by registration has opened for seniors 65 and older. To date, 1.9 million seniors have been approved for the plan. Lee began treating patients on May 1st and has seen about 20 seniors through the CDCP. 79-year-old Morton was one of the first patients. He booked an appointment the first day he was covered. We are so happy, Morton said, adding he hadn't seen a dentist in 5 years because of the cost. The dentist is expensive, so that is why I wait, till the problem was very bad, he said. Every morning when I wake up, I have blood come out of my mouth. Oh, God. That's horrible. And again, like if you had the money to just get the cleaning and the cavities filled, then it would never get this bad. And it just keeps on getting worse and worse. We shouldn't have to live like this in this country. Dr. Lee said most of the seniors he'd seen under the CDCP have been in similar state, having avoided visiting an oral health care provider for years because they didn't have the private insurance and couldn't afford to pay out of pocket. And that's because if you're on CPP, you get paid pennies. Yes, pennies. They get paid more than what I would get paid on Ontario disability. You get a bigger check, but you get no coverage of any sort. So none of your medications is covered. Everything you need then comes out of that one check. And so you have to start making sacrifices. Do you get your heart medications or do you get a cavity filled? And of course, this happens to people as they're aging and will most likely need this care the most. I've been reminded time and time again of the moral and ethical duty to serve with every one of these patients that comes through, he said. To the federal government said that 46,000 claims have been processed under the CDCP to date. Lee says his clinic has been reimbursed for the procedures within 48 hours by Sun Life, the insurance company that Ottawa contracted to do the administer the plan. Yes. Corporation Sun Life has to be involved, and I'm sure they're making a mint from it. It's been seamless, Lee said. It's been no different than regular insurance. For most of the procedures he's done, Lee said the federal government is reimbursing him at about 80 to 90% of what the Ontario Dental Association recommends. That's similar to private plans, he said, where dentists charge their patients the difference. So the thing is that, again, sounds good, and it does benefit a lot of people. But when you have private insurance through your workplace, you're also getting a paycheck. That 10 to 20% is still a lot of money to people who have no money. But private dental associations across Canada have raised concerns about the CDCP, arguing the national program requires dentists to agree to unnecessary terms and conditions. We don't want it because we might not make enough money, blah, blah, blah. So here's Jagmeet Singh just bragging about this is what the NDP has done for everyone. And by everyone, it means tested certain people with different incomes and ages and not full coverage.
We really believe this is the first step towards ensuring everyone gets health care that covers you truly from head to toe. Dental care today, and in the future we want to look at other elements of care so that everyone gets the care that they need.
Federal NDP leader Jagmeet Singh was in Vancouver Friday to announce new details of the NDP's dental care coverage.
We successfully demanded and obtained a historic national program that will provide dental care to over 9 million Canadians.
The program will now open to people with disabilities and children under 18 starting June 1st, meaning about 1 million more Canadians will gain access to the program. While the program is moving in the right direction, there are still concerns as to whether or not enough dentists will be willing to sign up.
I've heard from lots of people that it's working well. Dentists are getting paid very quickly. The program does work, so I encourage dentists, sign up. This will work for you. And I encourage patients to get out there and get the care.
Seniors have been able to access the NDP's dental care plan since May of this year. Skip McCarthy, a local senior, says it had been almost 2 years since his last dentist appointment before enrolling in the plan. He says with minimal pension and no other income, his dental care was falling behind.
And I'm realizing the lack of dental care, it can slowly kind of feed depression because you know you're falling behind, you know it's not going to be good.
Singh says people with disabilities face a number of struggles that are increased with the lack of dental care.
It only makes it even more difficult if they don't get access to care for their teeth. It just makes every other challenge they're up against even that much more difficult. So we think that this care should have always been a part of our healthcare system. This is long overdue, and we use our power to make sure people get access to this care.
Eligible Canadians looking to enroll are encouraged to visit local senior centers or community centers. In Vancouver, Lauren Stallone, City News.
Then I just wanted to get to this. I don't know who this person is. Just kind of came across this tweet. Stephen Best, environment, animal protection activist since the early 70s, motion picture maker, writer, co-founder, Animal Protection Party of Canada. And so he's probably one of the people who are over 70 that qualified for this. And there's a reason why I wanted to get to this tweet from this random person I don't know. So he says, first, thanks to Jagmeet Singh and Justin Trudeau, I will be getting a routine dental cleaning paid for by medical insurance. Never before happened in my life, always paid out of pocket. So a big I appreciate it to Liberal and NDP. And a big FU to Pierre Poilievre and everyone who polishes their apples and puts lipstick on them. That's just an interesting phrase. Because, yeah, if it was up to Pierre Poilievre, this plan wouldn't exist and most of our healthcare will be stripped away. Now, the reason I wanted to get to this is just the divide, the response, how polarized people have become with something that would ultimately benefit everyone, regardless of your political leanings. So this person saying, I pay for my own dental cleanings. I'm one of those tax cheating entrepreneurs with a small business. I'm happy to keep paying for my dental care. You, on the other hand, are capable of paying, but would prefer to be subsidized by taxpayers. Weak. Okay, so first of all, you're just admitting on social media that you're cheating your taxes. Brilliant move there. That is alpha behavior, just out there acknowledging that you don't do your taxes or you're cheating on them even. But just this idea to be subsidized by taxpayers, weak. I think we'll get to it, but yeah, we get subsidized on a lot of things in this country. And then you have to love the free stuff. And then Stephen just replying, I don't get anything free from the government. I've been paying taxes since at least 1954 when I first used my allowance to buy something. Let's see if it's part of this one. People have no idea how dangerous dental infections can be. They can eat their way through cavities. And so this person is like, this is huge. And it is. It's very beneficial for the people who can access it. Yeah, there was just somebody else pointing out, like, you're upset that some dental care coverage is going to be covered, but it's like we have our health care, schools, roads, like all of the other things that get subsidized by the government. That's okay, but trying to add something else that would be a net benefit to the country financially and just population happy-wise. Oh no, we can't do that. We can't do something that the people would want and would benefit them. Thanking them for using your tax dollars to give back to you in the form of dental care. What if they didn't tax every dollar that gets touched, then piss away much of it on building more government bureaucracy so you have more disposable income to pay for your dental? No, as I always say, I'd be fine in paying more in taxes if the government actually did what they said they were going to. Sure, I'm fine paying taxes if it means I get health care and dental care. Yay! If the cost of living is affordable, So what? I want to pay that because even if there's a time when I'm not struggling, there's other people who are. And I want to make sure everyone gets the benefit of getting the same care, the same help, so that they don't suffer. Like, paying tax money helps your neighbors not suffer. Because not everyone can work. Not everyone can work jobs that pay well enough that would be able to cover a lot of the stuff that you need. It's really just kind of heartless, this idea of, no, I don't want to pay taxes because I don't want other people to benefit from a system designed like that. This person, that's why my taxes cost so much this year. No. No. I don't think this really had much of an impact on taxes. Don't quote me on it. I don't know. Thank the taxpayers. As always, they get stuck paying for others. You should pay. It's like you pay for yourself and others. You should pay for your own teeth or a medical plan to cover your needs. If the government can sell resources and pay it in other ways, I'm for it. But taxpayers shouldn't. It's like we don't get to pick and choose what taxpayers cover. That's what the government's for. But it's just, again, it's this sick idea of like everyone should be paying, like this idea, this somehow horrible obligation that you help others. Because so many people can't afford to go to the dentist or afford a payment, an insurance of any sort, because their jobs don't pay well enough or because they can't work. But no, so those people, they should just suffer because basically then they deserve to suffer. Poor people deserve to suffer because they can't participate in society the way that a few people deem they should be able to. It just drives me crazy. Like, should be universal dental care, universal pharmacare, universal hearing and sight and mental health, like all of that should be covered, because this idea of we're only going to cover certain parts of you and then expect you to be able to function fully in society is just ridiculous.